Hello, my name is Lisa Gerber and I'm a student nurse from Cedar Crest College. Today I'll be discussing a presentation regarding the 12-hour nursing shift and patient dissatisfaction. I'm particularly interested about this topic because when I graduate I anticipate having to work 12-hour shifts, and also because patients need to feel satisfied with their health care, whether it be spiritual, physical, emotional, or mental care. The current literature does support an association between patients' dissatisfaction and nurses who work 12 or more hours per shift. This is a current significant concern, mainly because the United States is more likely to employ nurses who work 12 hours per shift and new nursing graduates that may want to take on that opportunity. Along with working 3 12-hour shifts per week, many nurses find more time for non-work-related activities. Along with the nursing shortages and weak economy, many nurses have felt that they need to work longer hours. With all this information presented here, the clinical question is, what are the effects of nurses working 12-hour shifts versus 8-hour shifts on patient satisfaction? The literature search and retrieval was guided by the use of Google Scholar, PubMed, Central, and ScienceDirect. The main keywords and phrases used included 12-hour shift, 8-hour shift, patient satisfaction, nurse burnout, and long working hours for nurses. After applying a date range filter between 2008 and 2015, and an additional filter of only trials conducted in the United States, there were 3 remaining articles that were found to be applicable to the clinical question. The first trial was a meta-analysis study done of 21 separate studies, and this was done by Bay and Fabry and published in 2013. This trial looked at how the 12-hour working shift can negatively affect nursing and patient outcomes. This trial found that 19 out of the 21 trials reported patient adversity as a result. This included patient dissatisfaction. The second trial was a quasi-experimental study done by Bay and Yoon, and it was published in 2014. It took survey data from registered nurses from the years of 2004 and 2008. It looked at mandatory overtime work policies for nurses, and the results stated that nurses who had second jobs or children at home were less likely to work overtime. It also stated that any mandatory overtime completed also led to longer working hours, which eventually leads to patients and nurse adverse outcomes. The third trial listed here was a secondary analysis of cross-sectional data from 3 sources. It was done by Stimfel et al., and it was published in 2012. This trial investigated the nursing relationship between working 12 hours per shift or longer and how that affected nurse burnout, nursing intent to leave job, and also specifically patient dissatisfaction. The results stated that patients had more satisfaction when their nurses worked 8 to 9 hours or less per shift, as opposed to greater than 12 hours per shift. Those patients reported dissatisfaction with care received. After reviewing all these trial findings and additional supportive evidence, there's certainly a need for some recommendations to the 12-hour nursing shift. As you can see here, the first recommendation may include keeping a nursing staff ratio at an appropriate level. The nursing manager or somebody of the sort would have to look at the number of occupied beds and make sure that the nursing ratio is appropriate, so that patient care can be at quality level and so that nurses don't feel fatigue or burnout. A second recommendation would include a nursing manager or somebody else of that level to take a look at all of the nurses' emotional states. Any nurse that's found to be having any emotional exhaustion of any kind needs to be evaluated further. By evaluating the emotional exhaustion, we can help create quality of care for our patients by helping these nurses. Lastly, the third recommendation here is for the institution to incorporate an additional break into the nurse's schedule. This should be done in the form of a nap or a rest period. Many nurses experience fatigue with a 12-hour shift, and possibly a nap or some type of additional break in between the shift can help to increase energy and restore energy and help with patient outcomes and satisfaction. In conclusion here, there is a significant amount of evidence supporting the answer towards the clinical question from earlier. The longer the nursing shift is, the more patient dissatisfaction there is. The 12-hour nursing shift is not going away, at least not in the near future. With further review on the concerns discussed here, new nurses may become more informed on how working overtime can impact themselves and their patients. The main concern here is to keep patients satisfied with their care, and also to help nurses feel better about providing that care. So I thank you for your attention today on today's presentation. I welcome any comments or concerns on the presentation, and thank you for watching.